Alright, so for my chief complaint, I had a 13-year-old Caucasian male who presented with 2 weeks of vomiting and abdominal pain. History of present illness: patient began vomiting with abdominal pain 2 weeks ago, and it's located in the epigastric area with no radiation. It worsens when he's hungry or when he has just eaten. He's tried to not eat to help, but the pain is still there, and nothing else has been tried at this time. He does note the pain has worsened over the past 2 days, and it's now a 10 out of 10, and the vomit is normally clear in color or the consistency of the food that he would have just eaten. The patient vomits about 4 to 5 times a day, hasn't had a bowel movement in 5 days, decreased appetite, decreased energy, decreased hydration, but has an increase in urine output with no burning or pain while urinating. He has a slight headache that waxes and wanes, and after the appointment, the father called us to say the son had an 8-inch long plastic-looking object in the stool. The rest of the ROS was within normal limits. Past medical history was insignificant. There was no past medical history of disease noted, not on any medications, no allergies, up to date on immunizations, no history of hospitalizations, surgeries, or childhood illness, and he gets his yearly physical with the pediatrician. Patient's mother has hypertension, and then the cousin on his father's side and aunt from mother's side both have celiac disease. For social history, he is in middle school and is in 7th grade. He doesn't drink alcohol, use tobacco products, or participate in recreational drug use. He eats a healthy diet and is always constantly hydrating. He plays soccer, hangs out with his friends, and takes walks in the woods with his dog. They recently went on a family trip to Greece about 3 weeks ago. Physical exam: vitals, heart rate was 92 and regular, respiratory rate 16 and non-labored, blood pressure 108/74, temp was 102 degrees Fahrenheit, height was 5'5", weight 96. This was significant since he previously weighed 106 at his yearly in March, and he had a BMI of 16. On general exam, the patient had a well-developed, well-nourished male that appears fatigued and gray in color. He appears to be in no acute distress, but he sits slouched on the exam table. Integumentary system was seen to have the gray in color for the skin, but no cyanosis, rashes noted, no lesions. ENT was significant for lips that were dry and cracked, and buccal mucosa that was dry without lesions or erythema. Rest of the HENT exam was within normal limits. The neck exam was within normal limits, no lymphadenopathy noted. Cardio within normal limits. Palm within normal limits. MSK within normal limits. The abdominal exam had no visible hernias or masses noted on inspection. Normal active bowel sounds all 4 quadrants. Soft but tender abdomen in the epigastric area. Percussion was not done, and no hepatosplenomegaly or abdominal masses were noted. The neuro exam was within normal limits. So for labs and diagnostics, we ordered a CBC with differential, CMP, hemoglobin A1C, and the stool culture. Our differential diagnoses were a tapeworm infection, diabetes, small bowel obstruction, gastroenteritis, appendicitis, GERD, peptic ulcer, and cholecystitis and constipation. At first, our initial diagnosis was diabetes, but once we got the lab work back, we diagnosed the patient with a tapeworm infection. The CBC, CMP, and hemoglobin A1C all came back within normal limits, but the stool culture actually showed parasite larvae and eggs, and also tapeworm. And at this time, we don't know exactly what kind it is. For the diagnosis, counseling, we told the patient that he had a tapeworm due to food or water that was contaminated while he was in Greece about 3 weeks ago that he ate. He was told not to worry, it's treatable with medication, and explained that the tapeworm eggs or larvae get into food, contaminate it, and then the person who eats it gets the tapeworm in their GI system. Patient was told that the vomiting, abdominal pain, and the loss in weight are all side effects of having the tapeworm. For treatment, for pharmacologic treatment, we did albendazole, 400 milligrams PO once a day for 3 days, and we are thinking of repeating this course in 2 weeks if needed. We told them the side effects of the meds were dizziness, nausea, headache, acute abdominal pain, and alopecia. Patient and his father were told to try to increase fluid intake to keep the boy hydrated, especially since his buccal mucosa were shown to be dry. And he was told to use the brat diet to start with lighter meals to see if he could keep it down and then progress to heavier meals as he began to be able to keep things down. He was told to wash his hands with soap and water, and the patient was told to check their stool as well to see if there's any more occurrences, and he was referred to GI for treatment. For worsening symptoms, we told him to go to the ER if the vomiting or abdominal pain worsened, or if he began to notice blood in the stool or vomit. And for follow-up, he was told to call the office if he had continuing symptoms once the medication had been completed in the 3 days, and if not, we wanted to set up a follow-up appointment in 1 week, even though we referred him to GI. Diagnosis and treatment options from literature showed that the stool sample is obviously the best way to see if there are any tapeworms or larvae or eggs in the stool. This suggested that the stool culture should be taken 3 different times on 3 different days and examined. And then for treatment options, the praziquantel is actually the medication most often used to treat an active tapeworm or parasitic infection, and it's given 5 to 10 milligrams per kilogram orally once for adults and 5 to 10 milligrams per kilogram orally for children. Available evidence suggests that the 10 milligrams per kilogram once orally has a higher rate of cure than the 5 milligram dose, and then the albendazole is normally recommended if the first medication is not effective or if it's contraindicated. Both medications should be used cautiously with the cysticercosis, just because there are reports of seizures. Yeah, and then these are the references.